Thank you, Presiding Officer, and I remind the Chamber that I am the Parliamentary Liaison Officer to the Cabinet Secretary. To ask the Scottish Government what action it is taking to ensure that police stations are resourced to support people with mental health problems.
There is increasing recognition of the key role that police play in supporting people who are vulnerable or in distress, including people with mental health conditions. The draft Policing 2026 strategy, recently published for consultation by Police Scotland and the Scottish Police Authority, emphasises the importance of a partnership approach in providing effective support to people with mental health conditions. There are already very good examples of collaboration between Police Scotland and NHS partners to improve the response and service to people in distress or suffering from mental health difficulties. For example, community triage services, which provide officers with an out-of-hours service to community psychiatric nurses, are already operating in the Glasgow area and in Edinburgh, and several other areas across Scotland are developing similar services. The Scottish Government's mental health strategy contains an action to increase the mental health workforce, to give access to dedicated mental health professionals in a number of key settings, including the police service. In order to meet this commitment, the Scottish Government will increase additional investment to £35 million over the next 5 years, and this will pay for 800 additional mental health workers in these settings.
Tom Arthur.
Can I thank the Cabinet Secretary for that answer? Given that as many as 80% of incidents attended by Police Scotland are non-criminal call-outs, including responding to vulnerable individuals and individuals with mental health conditions, does the Cabinet Secretary agree with me that the provision of a dedicated mental health professionals to police stations across Scotland will be an invaluable addition to local policing?
Cabinet Secretary.
Well, Presiding Officer, it's important that vulnerable individuals, particularly individuals who may be in distress or experiencing mental ill health, that they get the right support at the appropriate time when they contact one of our emergency services, including the police service. That's why the additional investment which we're putting into the mental health workforce will help to support increasing capacity to assist the police in addressing issues relating to mental ill health. It is also, Presiding Officer, worth noting the significant work that Police Scotland are already taking forward. Last week I had the privilege of visiting Police Scotland's Fife Divisional Headquarters in Glenrothes and was able to see firsthand the excellent work being undertaken to equip officers and staff with the skills to support people who have mental ill health or are experiencing distress. And Police Scotland are leading the way in this with the training of all of their officers up to the rank of Inspector, which will involve the training of some 17,500 officers, which will be completed by May of this year, all being trained and equipped with the knowledge and the skills to be able to work with individuals who may be experiencing mental ill health and distress, and to be able to respond to that in an appropriate and effective way.